Good afternoon and welcome to today's Health and Wellbeing board in Kirklees. Have we got a lot of feedback there?
Yeah, we seem to have.
Can I remind participants that this meeting is webcast and also recorded, and if you wish to speak or ask a question, will you use the chat bar, please, not the hands up symbol, and will all board members keep their cameras on, please, so that you're visible, and all others switch their cameras off until such a point that they're speaking or presenting. So, Jenny, have we got any apologies from board members, please?
Yes, we've got apologies from Richard Parry, Karen Jackson, Mel Meggs and Rachel Spencer Hensel.
Thank you. Any others? Anybody who needs to notify us? No?
Sorry, just to say I'm covering for Mel Meggs.
Okay, fine, thank you. Phil, will you go?
Sorry.
Well,
sorry.
if you hold still, folks, I'm going to say to Phil, will you go through the list of attendees and state who is subbing for who in whose place? Phil, you're on mute.
So we've got Councillor Carol Patterson, Councillor Mark Thompson, Councillor Pinnock. So we've also got Emily Parry Harris, who's subbing for Rachel Spencer Henshaw, the Director of Public Health. We've got Helen Hunter from Health Watch, Carol McKenna from the CCGs, Richard Mellor, I think, is subbing for Karen Jackson from Locala. We've also got Diane McKerricker on the call, who's the chair of Locala, Dr. Steve Ollerton from Greater Huddersfield CCG, and Tom Brailsford from the council, who's subbing for Mel Meggs. I think that's everybody.
Okay, speak now if we missed you.
Apologies, Catherine Riley from CHF.
Thank you. Could I remind and ask board members to put their video cameras on, please? I'm not seeing them all as such. So if we can move to item 2, please, which is the minutes of the last meeting held on the 17th of September. Have we got any amendments or corrections, Jenny? I understand that we have.
Yes, we've got a couple of corrections to do with the spelling of a name, and Karen Jackson's apology was not noted, so I've made a note of those. Is there anything else?
Don't know. Anybody else got any other corrections that we need to be aware of? Steve Ollerton's put a message up, I think, that's gone again, and I'm not sure what it is. Okay. So
yes, thank you. Noted.
Okay. I don't think there are any matters arising from those minutes. All the things were either to note or to bring back at future dates to this meeting. So I'm looking for anybody to have an exception. Otherwise, I will take it that those minutes, once corrected, will be accurate. Are we all happy with that? Yeah, fine, thank you. So can I remind anybody, if you have any interest to declare, to please use the form in the pack that you will have, and let Jenny have the form as soon as possible, please. All the items on this agenda are in public. There is nothing to be held in private as such. Jenny, have we any deputations or petitions?
No, we haven't received any, Chair.
Thank you. And item 6, have we any questions from members of the public?
Again, we haven't received any.
Thank you very much. So we then move to item 7, which is the COVID-19 update. And I know originally on my sheet it said Steve Brennan and Rachel Spencer Henshaw were going to do a presentation of this. I don't know at the moment if it is just Steve Brennan or if it's Steve and Emily.
No, it's just me,
it's
Councillor
just
Kendrick.
you.
So
I was looking
you are
for
going
Steve's name.
you're going to have to suspend disbelief in a couple of different levels. So I am going to be Rachel Spencer Henshaw for the purposes of the update on COVID-19 and the figures, and then you are going to have to further suspend disbelief where I turn into Steve Brennan to give you the brief update on the vaccination programme that Steve is the SRO for.
Okay, thank you very much. I have every belief in you. Can I remind everybody, if you have any queries or questions, please just type speak in the chat bar, and then we'll address those to Emily, stroke Steve at the stroke Rachel at the end of it. Right, over to you, Emma.
I'm going. Oh, hang on. This is where my technological skills let me down. I am just trying to share my screen with you. If this doesn't work, oh, that's not the right one. So what I'm going to do, I'm just going to talk you through the figures, and I will share my presentation afterwards, if that's all right with everybody, because otherwise we'll spend ages with me messing about trying to
okay, no
to
worries.
share my screen. Now I can't now work out how to unshare my screen. So perhaps you could just all ignore the screen for a minute while I talk through some data. I'm sorry about that. Okay, so the data that I'm going to talk through is the data up to the 24th of November. So it relates to the confirmed cases up to the 18th of November. The hospital admissions in the latest week are lower than in the previous 3 weeks. So that's been a positive direction of travel, and that applies across both CHFT and Mid Yorks Hospital Trusts when referring to Kirklees residents. The weekly cases being reported of COVID-19 have also dropped in the previous week. The week beginning the 5th of November, we had 2,580 cases. The week beginning the 12th of November, we had 2,103. The weekly rates per 100,000. Our rate in Kirklees is 478.2 per 100,000, which ranked us as 5th in the country, and the highest rate per 100,000 in the West Yorkshire local authorities. These move around a lot, and I think it's really important to recognise that whilst it's not good that we have the highest rate per 100,000 in West Yorkshire, when we talk about this in a week's time, I'm very, very confident that it will be different and that somebody else will have moved into that top position. The most important thing to take from our rates per 100,000 is that it is decreasing, and our level of decrease was fairly steep in the previous week, having been rising up to that point. I've just said that our weekly rate was 478.2 per 100,000. That compares to Bradford, who were at 468, and the next highest, Calderdale, were at 401. So that's a very, very brief update on the data. In terms of what we are currently learning about the confirmation of which tier we're likely to go into, we are expecting to go into tier 3. The legislation that relates to the specific content of those tiers is being read in Parliament today, so we will receive that legislation overnight. It looks broadly like the tier 3 authorities will be very similar to how they were prior to the national lockdown, although the rule of 6 is being reintroduced, so you will be able to meet up with up to 5 other people from outside your immediate household in public open spaces. But as I say, I haven't seen the formal regulations because they haven't been read yet, but they will come into effect from midnight on the 2nd of December. Shall I pause there and ask if there are any questions on the data? And if there aren't, I will magically become Steve Brennan and tell you what he tells me he knows about the vaccination programme.
Okay, anybody, any queries or questions to ask Emily at this point? Not seeing any, Emily.
No.
So
Okay, well, in that
Okay.
case, if you could further suspend disbelief, and I will turn into Steve. So Steve sent me a written update, and apologies, I'm gonna read some of this out to you because it's the easiest way to do it. So the government has asked the NHS to be ready to deliver a COVID-19 vaccination programme as soon as one becomes available. In West Yorkshire, planning and delivery is being carried out teams in Kirklees, Bradford District and Craven, Calderdale, Leeds, Wakefield and Leeds Teaching Hospitals NHS Trust is coordinating this work. We're working to the guidelines set out by the Joint Committee on Vaccination and Immunisations and considering all aspects of the vaccination programme, including who will administer it, where it will be provided from, the logistics of doing that, how we will provide accurate and useful information to people about the vaccines that they're receiving, how we will ensure that the vaccine is accessible for everyone within our communities and included within the how we will administer it, how we will record that it's been administered within people's primary care records. There's obviously been a lot of noise in the press over the last week or so about the vaccines becoming available, but as things stand today, there is still not yet a confirmed vaccination, although extensive planning is underway for a number of different scenarios. And you'll have heard there's the Pfizer vaccine that needs to be kept at very cold temperatures, the Oxford vaccine, which is slightly easier to manage. We'll be building on the models that we have in place for the delivery of the flu vaccine. The current guidelines are that the first priority groups to receive the vaccine will be care home residents and staff, health and social care staff and people aged over 80. And we are being asked to plan, as I said, for that to start from the beginning of December. I think it's probably likely that that will actually start the second week of December by the time the vaccine is available. So obviously the vaccine will have undergone the strict clinical trials and is approved for use by the independent regulator before it's rolled out. And we're aiming to deliver a safe and effective vaccination programme whilst also continuing to offer timely access to other health and care services. And clearly there's going to be significant demand on primary care's time to deliver the vaccination programme. And one of the things that we are trying to say and get the messages out there is to ask patients to not contact their GP practice for information about the vaccine, as we currently don't have any further information available, and it will just block up the primary care phone lines. So that's where we are with the population vaccination programme at the moment. We are also, and you'll have seen in the press and on social media, planning for a rollout of a population testing programme using the lateral flow tests to start within the next couple of weeks as well. So there's a huge amount of work going on, and I just want to publicly say thank you to everybody that's involved with us. We are all working incredibly hard. People are tired and people are flagging, but we are still managing to plan for this work with a level of kindness and tenacity. So thank you everybody for that.
Thank you, Emily. Any questions or comments, colleagues? Can I just, while people are thinking about that, can I just pick up, Emily, on the getting the message out not to contact GPs about the vaccine?
Yeah.
Is that something that we as a council are putting out? Are the CCGs putting that message out? Individual practices? How's that happening?
So we have a group now that meets across the council and the CCGs to coordinate comms. So it will go out through that group. So Siobhan, or somebody from the CCGs, help me with Siobhan's surname.
Jones.
Thank you. Oh, you're not even from the CCG, Phil. That was very good. Steve Ollerton did that without moving his lips. Siobhan Jones is coordinating that, but Marcus from our comms team is very involved in that as well. So we'll do that together.
Oh, that's good, because I can just see how important that message is. We just don't need phone lines and things clogged up with something that's pointless doing. So I've got Kath Pinnock who would like to speak. Kath?
fiddle. Oh, you know, you'd think we'd all know by now, wouldn't you? So that was amazing what the teams have achieved in health and social care and public health. All praise and credit to you, because the pressure must be enormous and unremitting. A couple of queries. The priority groups for vaccination, can I just confirm that they are determined by government?
They are,
Right.
yes.
I mean, that's really helpful. So, you know. And you, in your list, you said care home and staff and residents, and then 85 plus. I thought NHS workers were going to be included in.
So I said, sorry to correct you, but I think I said, I hope I said, it's what I intended to say, that the priority groups will be care home residents and staff, health and social care staff, and people aged over 80.
Right. I didn't hear NHS, you see, so I thought.
Sorry.
No, my fault, didn't it? No, it's my fault. That's fine. That's great. Thank you. And the numbers of those will be quite significant. So 20,000. That's my guess.
Phil Longworth has been doing some multiple arithmetic to work out specifically what those numbers will look like, but it's probably specific enough to say, Councillor Pinnock, a lot.
A lot.
That technical term.
Absolutely. I'm blowing you away with my epidemiology there, I know, but a lot.
20,000 was a very, very good guess.
Oh, right. Okay. Well, okay. I mean, because I think that helps if people ask us, well, why haven't they done it yet? Why aren't it all finished? So if we're able to say, as local folk, local councillors, to say, well, actually, do you realise there's 20,000? That's a lot of people to get done. I think that helps. So, well, even Viv's nodding, so I must have got something right. Then the next question is on to the vaccination. Sorry, the testing. And these lateral flow tests, you know, the 30-minute instant answers thing. Is that confirmed now that that's what Kirklees are going to get, or is it still waiting for somebody?
We are still waiting for final confirmation that that's what we're going to get, but we've put in for 2 programs of work, one to have 10,000 lateral flow tests available to us for use with targeted individuals, and a second piece of work to undertake mass population testing with the lateral flow tests. If we're successful with the mass testing, we'll be required to test 75% of all of the population aged over 18 in Kirklees. So I know I blew you away with my that's a lot of people answer to your previous question. Well, that's a lot of people.
Well, that'll be about 300,000. No, that'll be about 250.
If you let me have 2 minutes just to find the bit in my notebook where I
well, it's a lot of people,
it's a lot. It's about 250,000 people.
Oh, there you are. God.
So yeah, you weren't far off actually.
Good. I'm just looking at the remark that Steve Ollerton's put in the chat that 100,000 flu jabs have been delivered this season. That sort of gives you a bit of the feel of the scope,
scale of it.
The scale,
absolutely.
And again, I mean, sorry to go on a bit, but again, I think it's going to be really important to put this in context for folk, because the 100,000 flu jabs is amazing, but it started in September.
Yeah.
You know, so.
So it's a smaller program over a longer period of time, and the other point that Steve's made in the chat, and I'm sorry I should have said that, is that we need to remember that the COVID vaccine is 2 jabs separated by 3 to 4 weeks. So there's a whole call and recall program that will need to be run there as well.
Yeah. So I suppose what I'm saying is, if possible, if you know, those of us councillors who sort of get asked questions or want to calm down folk on Facebook and everything else can have some of this info, official info, rather than my guesstimates. We can help just let everybody know what to expect, and not to expect
Yes.
things that are instant, because it's going to take us all, isn't it, to you know, get the information out. There's no good putting press releases or stuff on the, with all due respect, put stuff on the Kirklees website, because people don't know, they don't look there. And you know, I'm constantly have queries about, well, what's going on, and you know, so and you know, other councillors on here will perhaps agree with that, I don't know, but
yeah. The numbers become pretty mind-boggling when you start to...
And again, and anything we can you know, we can do to help, let us know.
Thank you.
And end of.
Thank you.
Thank you very much. Okay, Mark Thompson.
Thank you. Just a question on, a bit of a pragmatic question really on cost. So to administer the vaccine, similar to the flu vaccine, there's generally a cost per head that I believe gets picked up by government, and just wondered, is the cost of administering these vaccines, especially when it's 2 times, is that going to be free from CCGs and anybody else that's got to administer it, or is there a payment that they get per vaccine administered? And who's got to pick up the cost?
So can I ask Steve or Carol to answer the CCG question? Would that be okay?
Yeah, sure, I can do. It's £12.56, I think it is, paid per vaccine, and that has to cover the staff and the administrative, everything that needs to go around that. There is going to be a separate pot of money for what they've called infrastructure costs. So if we do need to set up, you know, road signs or other portable things that we might need, then they will come from a separate pot. But essentially, the primary care networks who are running the first phase of this, that's what they'll get paid. But obviously that's multiplied by 2 because it's against 2 jabs. So, but that's what it will cost. And yes, it is being funded nationally. That's exactly the same for everywhere across the country. It's what we call an enhanced service. That's what will be paid.
Thank you. Have you anything further, Mark, or is that it? Yeah.
That's all then. Thank you.
Yeah. Okay. Thank you. So Helen Hunter.
Thank you. This might feel a little bit like, well, it will feel like a niche question. I'm particularly interested in, obviously, the voice of people who are living in care homes at this period of time. And I'm also interested in their ability to choose whether or not they have the vaccine, if they have capacity to do so. I think there is something that's really interesting about, obviously this is a group of people who have enormous vulnerability, but who should be given the opportunity, if they can, to make their own choice about whether or not they would want this sort of clinical care. I'm just mindful of, and probably something that's already been thought about in terms of assurance, that actually if people residing in care homes have the ability to make their own decision, that they are going to be allowed to do so in terms of the vaccination.
Yeah, we have never had a compulsory vaccination programme in this country, and I haven't seen anything to suggest that this vaccination programme will become compulsory. So if people have capacity to make their own decisions, then absolutely they should be allowed to make their own decisions.
Can I just add something?
Yeah,
come for me.
I totally agree with what Emily said. I mean, what I would say is that it would be nice if we have some handy leaflets or handy information that we could, not just for care home residents, for anybody that wants to make that decision. But essentially, what you're talking about, Helen, I don't see this any different to the flu campaign. I mean, there are patients who do not want a flu jab, and we don't give them. I think the vast majority do have it, and yes, where possible, it will always be an informed decision. But any help we can have to provide that informing, it would be gratefully received.
And as soon as we have the formal confirmation of the information that we can communicate to people about the vaccines, we'll send it. But until the processes have been finally concluded, we can't do that.
That's really helpful to me in terms of just assurance in that situation. That's all.
Lovely, thank you. I'm just looking at what Phil put in the chat, and I'm just wanting some clarification. So you're saying there 23,000, is that care and health staff, Steve, plus 20,000 care home residents and over 80s? So the starter for 10 is 43,000 people times 2, because it's 2 vaccinations.
Yeah,
that's massive to start with, isn't it?
Yeah.
it is. It's an enormous programme of work, absolutely enormous.
Yeah. Gosh.
And it's Christmas.
Yes.
Noticed.
That's been cancelled, Emily.
No, it hasn't. Oh,
Go on, Phil, do you want to elaborate?
Just to say that those are the figures of all the people who are entitled to have it. The uptake will obviously affect how many people actually have it.
but we're expecting the uptake looks like it will be between 70 and 75%. So 70 to 75% of a lot of people is still a lot of people.
Yeah.
Again,
You're
to blow
there
you
with your
away with, I'm
mathematical
all over
terms
this
again.
maths, right? You're supposed to be able to make public health more accessible, Councillor Kendrick. That's what I'm trying to do.
That's what you're doing. Excellent. Doing an excellent job, Emily. Is there anything else you need to add to this presentation? Because I've lost track now. You don't have to turn into Rachel now.
Yeah, who am I now? No, I'll go back to being me now, if that's okay with everybody else.
That's fine. Okay. Steve Ollerton wants to make a last comment. Always likes the last words.
Well, I don't know if it is the last comment. I just wanted to say, when you were talking about not contacting GP practices, that would be welcome, that message. We have been told we'll be given 10 days notice of when the vaccine is going to land. So I think 10 days before, we need to flip it round into please do contact
Please
us.
do. Yeah.
But yes, don't contact us until that point, because literally we won't know until we know.
Don't contact us until we've got something to tell you.
Yes, exactly. That would be right.
Yeah,
absolutely.
Yeah. That's a strong message. Yeah, that's clear. Thank you very much, Emily. I think you've done a sterling job with your multiple personalities. Thank you.
Thank you.
So if we could move on to item 8, please, which is community engagement during COVID. And now then, it says on my agenda Helen Wright, but I think it's Helen Hunter.
It's here. I mean, I'll answer to both things. They're both acceptable. There's some stuff I won't answer to, but that's fine.
That's fine.
I'm just going to try and share my screen because I've got a few presentation slides to go through. I had an absolute nightmare with this in Primary Care Commissioning Committee, so I am hoping that it will work today. As the slides up on people's screen, that's great.
Yep.
Okay, so thank you ever so much for giving me an opportunity to just come and talk to you about the COVID-19 engagement work that Healthwatch Kirklees has been delivering. Sincere apologies to the people who have already heard me present this in various other forums. I'm going to try and keep it short so that you've got time to ask questions and have that kind of Health Wellbeing Board discussion. So what I'm going to do is I'm just going to talk through some of the key learning from the work, talk through what our next steps are, and then ask the board to consider how they can make use of the findings. Just going to start by saying a little bit about what Healthwatch Kirklees' response to the pandemic has been. So obviously 5 things listed there. The last one I'm sure is familiar to absolutely everybody. We've been doing a lot of work to support our staff and volunteers during the pandemic, because that's an absolutely core, essential part of everything that we're doing. But the other 4 elements of work we have been doing at various intervals and in various different amounts. At the start of the pandemic, we felt very much that Health Watch's role was to get out clear and up-to-date information about the kind of national messages, but also about what was available to people locally. And we created a frequently asked questions section on our website, which was actually really well visited. And so we're trying to get out some of that really useful information to people. And we got involved with the kind of community effort at that time. So local staff volunteered in Kirklees. And we started to deliver a telephone befriending service to people perhaps with additional vulnerabilities who were particularly isolated. So we worked with people with drug and alcohol problems, learning disabilities, to try to make sure that we reduce some of their social isolation. What I would say is we started with that, but actually our core Health Watch work is to amplify the voice of the general public, particularly focusing on those who might face the greatest inequalities, and to try to influence health and care delivery. So whilst we started at a place of providing information and support, we wanted to make sure we were doing the right thing by amplifying people's voices. And so the way that we chose to do that was by doing a big piece of engagement work across a 3-month period. So we launched a project at the end of May where we captured people's lived experience of accessing health and care services through the pandemic. The work was developed with partners in Calderdale and then replicated in Kirklees, sort of with the agreement of other partners from Kirklees. 3 key elements to that piece of work. One was the big experience survey, in which we asked people about which services they'd used, how they'd worked, what they'd liked and disliked, and we asked some questions about mental health as well, to find out about how people were being impacted. We set up some storytelling tools so that people could tell us about their experiences in more detail and more creatively if perhaps they didn't want to complete the survey. And you'll see in the report that there's examples of poems and sort of bits of prose and images that people have created to tell their experience. And we utilised our information and signposting and advocacy summaries, which are information that have been brought together by people contacting us by phone and by email to ask for our advice and support in terms of dealing with some issues and barriers, and reporting kind of best practice as well. So all of that information was brought together and analysed through a data management system that we learned how to use on the job over the summer. And you can see at the bottom there the sort of rate of response that we had, which gave us a reasonable sized sample of people who had shared their views. Now, you've all had a copy of the report and you'll be able to see within that report that there are 5 key themes. I don't want to go over that in too much detail because obviously all that detail's already been provided to you, but it's important to note that there was a balance of feedback in almost everything that we heard. So in terms of access to services, be that face-to-face, telephone, online, actually there were some people who felt like they'd had a significant improvement in their access, particularly to GP surgeries, because they were able to access by phone and because they were able to get in contact online. However, there were obviously some people who felt like because they weren't able to see somebody in person that had been more challenging for them. But it's important to reflect both sides of the feedback. There were clearly some people also who'd had ongoing care cancelled or delayed, and there were quite a few questions about that sort of thing, and asking people to get to grips with online systems sort of immediately at a point when everything's had to change very suddenly presented some challenges for people who weren't necessarily digitally enabled. In terms of communication, I would say that we got more negative feedback about communication, and a lot of that was about people understanding what was available to them, and the timeliness of the information. Now, I understand obviously at the start of the pandemic it was not feasible for everybody to be providing really up-to-date info about exactly what was happening in their services, because everything was changing so fast, but we're certainly in a position now where we can provide really comprehensive information about what people can access. In terms of quality of care, we got some really, really lovely feedback from people. People were very complimentary about the staff that they'd interacted with, and we got really good feedback, particularly from older people who were so supportive and grateful for the support that they'd received from health and care professionals. And in terms of cleanliness, hygiene and infection control, we had some information come through about personal protective equipment and use of that. A lot of requests and a sort of information about lack of clarity about what some of the national messaging was and about testing, things like that. So a lot of that relates to kind of information that people were provided with. And you can see that there were 2 additional sections in the report, one that was sort of linked with people's kind of demographic and socioeconomic characteristics, and whether they differed because of, whether people's experiences differed because of that. And there's a lot of feedback in the report about maternity services and people having, women having had poorer maternity experiences because they weren't able to be supported by family at appointments, and how that had impacted mental well-being. And then there's a big section on mental health, with most people reporting that that the pandemic had a detrimental impact on them, causing some level of emotional distress rather than mental ill health. Most people talking about struggling with coping with homeschooling, with isolation and things like that. Obviously, that's not the end of our piece of work around COVID. We definitely need to continue to do some more work, and there's some specific groups of people that we would want to do some more engagement work with. Our findings from our report were not representative of our communities, so we would want to do some more engagement work with Black, Asian and minority ethnic communities. We're very keen to try and gather the voice of people who are residing in care homes, and I've talked about that in various forums, and we're aware that there is perhaps a disproportionate impact on people with disabilities and long-term conditions at the moment in terms of delays in care. So we're certainly keen to work with those groups, and you can see there that there's 4 key other areas. I'm sure no one's surprised to see dental care, but other areas of work that we are really keenly interested in at the moment on the basis of what people are talking to us about. But as our next steps as an organisation, we're going to examine our data in more detail. So obviously we've pulled out 5 key themes, but there's an awful lot more that people have told us about, and we want to make sure that we're capturing the full breadth and approaching the right organisations to provide that detail. And we're going to focus on the new and emerging issues that I've just described. We really want to work closely with partners to ensure that views are being considered and captured during this period of time. Everybody is under so much pressure, and everything is so time consuming, but we want to, where we can, be helpful in terms of providing information that is useful and helps organisations to kind of reflect the needs of the public in the way they're providing their services. And we're doing a piece of work to map out the learning from engagement work across Kirklees, so we're not the only organisation that have done engagement work. In fact, almost every organisation has, and we want to get a clear understanding of what the picture is across Kirklees, so we understand what people have already been asked, what information we already have, and what we can take forward. In terms of our Ask of the Health and Wellbeing Board today, we want to establish whether you've got unanswered questions from the report, whether you feel like there are areas of particular focus that are needed, and talk about the way in which the health and care system as a whole could respond to feedback like this and other feedback from the public at this time. And I have quite a specific request about support from the agencies here in terms of mapping the local engagement work. For us, this is about pulling together the learning to make sure that people's voices are being heard as loud and clearly as they can be, and so we've made a contact to each different service, and we've had varying levels of success in terms of getting some of that feedback back. And my last slide is just one with some of our contact details. This has been sent through to you as this PowerPoint, so as well as obviously having the formal report. So I'll just leave that with you now in case you've got any questions for me, and kind of have that discussion about those key areas.
Thank you very much, Helen. Just before we move on to questions, I'm informed that the live webcast keeps freezing intermittently, and we can't stop it without stopping the whole meeting. And just to assure people, we are aware of that and apologise. Councillor Musrat Khan would like to speak or ask a question.
Thank you, Helen, for this report. It's been really useful to look at the themes across the different services. It's a shame there isn't that much feedback in terms of adult social care. There's snippets here and there, but the area I wanted to comment on was around communication. Now, most of the difficulties that we were having in terms of communication and guidelines that announcements were being made nationally on national TV, and yet the details and the guidance and the legislation hadn't gone through and we hadn't been sent information. So, you know, as a counsellor, I was absolutely, I'm sure, like my colleagues, were inundated with inquiries, and that was a very difficult situation to hold back. I mean, people did feel left in the dark, and it was for us, it was a constant kind of, can you wait till tomorrow morning? We'll have more details then. So, you know, I could see what was going on there in terms of the messaging and translation, and sometimes there were conflicting messages coming nationally as well, with different ministers and the PM saying slightly different, you know, or saying things in a slightly different way that could be open to interpretations. So there is a lesson there to be learnt, and you know, it would have helped us if we were forewarned or given details so we could prepare our comms in line with national announcements. So rather than having to play catch up and then very quickly, and I know our IT people often worked weekends and anti-social hours to try and keep up to date and update information as soon as they could and get it out there. Apologies if I've missed this, but I'm not sure if it's been sent, if this survey was sent specifically to counsellors, because during this COVID pandemic, you know, we've been a centre of contact for residents. And, you know, I would have personally have liked to have completed this on, you know, on behalf of residents and the issues and problems that they were facing. And I think that would have been provided an oversight.
I think those are all really useful comments. In terms of, sorry, the adult social care stuff, you're absolutely right. We really didn't get that much feedback about it. We've actually got more through some of our befriending support, where we've been working with people one-to-one, and they've had changes in their interaction. And perhaps in some of our more detailed story work, we could kind of reflect that a little bit more strongly to kind of tell some of those stories. I am working with the Safeguarding Adults Board around sharing the feedback from the survey that's relevant specifically to kind of some of the risks, some of our most vulnerable people. But yeah, I think you're absolutely right. We haven't got anywhere near as much feedback about adult social care services, and it's often much harder for those people to speak out in terms of kind of their inclusion if something's all online. So that's certainly something that we're really, really mindful of and aware of. In terms of the communication stuff, so obviously we have been in a similar position where when we've received information, it's kind of on the day, and it's very challenging to get that out in a timely way. We've been escalating back to our national organisation, Healthwatch England, who are often involved in some of the conversations about some of the communication messages. So we've been trying to influence through that national route, because actually it's really difficult for us to influence as a local health watch, but we can provide our intelligence and ask the national organisation to do a bit more for us in that regard. I don't think that our survey was sent specifically to counsellors, and that's something that perhaps we should think about. I know that it was sent through to sort of scrutiny panel members and things like that, but I don't think it went out as widely as all counsellors, directly certainly. And I think that that's something that we could definitely do going forward.
Lovely, thank you very much. Kath Pinnock again. Where are you, Kath? There you are.
Thank you very much, Viv. Thanks very much, Helen. That was an interesting read of in the papers. And what was fascinating is, with a different hat on somewhere else in London, where there was a select committee on public services and how they dealt with COVID, and identical results have come out of it. You know, so that should give you some, you know, confirmation that what you've got actually reflects a national pattern. There were lots of people said how much they preferred GP telephone conversations for minor stuff, and even video links for other appointments. And Of course, not everybody, because not everybody's comfortable with using those, which is what you found as well. So that came out, and I do hope there's a lesson there that GPs will be able to use more of those ways of getting in touch with patients, because they were obviously welcomed, and it should save time and for everybody's point of view. The other one was the maternity, actually, because that came out, and that was from another part of the country where we had information that maternity midwives, particularly not calling, I don't know whether there was a national decision that midwives shouldn't make personal, calls on folk. Whether or not somebody's thinking about whether that was appropriate to make that call, I don't know. I'm just saying what happened. So, and the same that information came out about people with mental health issues. It was really very similar. So I think you can take it that what you found is a pattern that's across the country, and that should give us some confidence in making decisions in the future about how services are delivered.
Thank you very much. I know there are quite a few challenges on page 59, I think it is, of the document, where organisations and services are asked to consider as such. And I just want to clarify with you, Helen, as to how you feel that should happen. You're obviously been and presented at the CCGs, and I'm wondering, are you going to different services and organisations as such with this same information?
So every organisation that's listed in the report has received a copy of the report and a request for the answers to the questions. Because obviously we set a time frame on this piece of work, which is something that Healthwatch is allowed to do, and it's something we've never done before. And we opted to do it in this particular circumstance because we were just so keen that we didn't want to lose the value, because everybody has so much on at the moment. We wanted to make sure that that this was given, some attention, but we were never expecting that anybody would be able to come back and say, we've changed all of these things as a result within that time frame. It was very much confirmation that people had seen it, that they knew that they could make use of it, that people had an opportunity to ask us if there was any additional data that they might want to see pulled out of the survey that would help them in terms of painting that picture. And so we've had varied responses so far. So the CCG have provided a full written response to the work, and I presented at both primary care commissioning committees, so that the people represented there could get an understanding of the work. I've had a one-to-one conversation with Yorkshire Ambulance Service, who have provided me with details about how this intelligence has influenced some of the work that they are doing. So actually it's kind of meeting notes that are evidencing how people have addressed how they've addressed the questions. So different agencies have opted to respond to this in different ways, and we're really happy however it comes, just as long as we're able to go back to the general public and say, you shared your view and your view was properly considered, and this is the impact that you sharing has had. And I know I've talked about wanting to create a little video clip that sort of says, I am a GP and I have changed, and this has changed as a result of things that the public have said. So that then we can really clearly reflect back to people the value of sharing their experience. So obviously we're in different stages with different organisations with that work. With the Health and Wellbeing Board, I think the conversation that I was hoping to have was about the fact that a lot of this feedback refers to the whole system and people's interaction with health and care as a whole, rather than perhaps the individual specific thing about a particular service. We can all learn from some of the different feedback that's in there. So I just wondered how the Health and Wellbeing Board might want to work together to kind of consider some of this feedback in terms of our strategic approach and the way in which we collaborate and utilise feedback.
That's a really good challenge. Thank you for that, Helen. I'll turn the tables a little bit because there's quite a bit in the document where people have talked about their own care in residential care or the care of their loved ones. And you're talking there about an enormous disparate range of organisations, aren't you, both private and statutory as such, you know, and how one addresses that with the care sector in those terms, I don't know. I'm looking at Phil's picture, not at Phil because he's hiding behind his picture, as to how we might take this forward as a health and wellbeing board, because you're right, it is about a whole system as such, as well as individual activities. And I think even if an individual organisation, service, GP practice doesn't say, oh, we're going to do that, because there probably are some recommendations that good practice will be X, aren't there, from the feedback that's there. Phil, you've put your video on, so I hope you're going to speak to us.
Helen and I are actually meeting after this meeting just to finalise this, but I think the approach that we think might work best is, rather than trying to write a long report, is to actually get people together who are interested in exploring this a bit further. And I think there's two particular things we're keen to focus on. One's about, as a system, people move through the system as they experience different bits of the health and social care world. And one of the things that clearly comes out of the Health Watch work is that people don't always know where they're at in that system and where they're going next. So we need to make sure as a system we get better at that. And the other thing is making sure that all the new ways we've found for people to access services and support reflect the diverse needs, and that, you know, not everybody feels comfortable using telephone-based systems, online systems. So as a system, we need to understand that and not just assume that people can, we can hand people off to some website somewhere and they'll be able to deal with it. So I think it is about bringing some key people together from across the organisations to discuss those issues.
Good. I'm reassured that you and Helen are meeting after this to discuss that and take that further for us. I am being asked, and you've sent me a message, Phil, saying to anybody who's watching the webcast that we've had to switch to audio only, but we'll be putting up the presentation for the next item. There are technical difficulties that aren't able to be resolved as such. So if no one else has a comment or a question, can I say thank you? I'm stunned by the piece of work. I know you wanted it, you would have liked it to be broader. Good heavens, it'd be like an encyclopedia, but I you know, unusually for me, I couldn't stop reading through it when I started reading it. It's that effective. So, you know, congratulations to you and your team. And thank you very much, Helen. Thank you. Oh, Steve's making an offer there as well. Happy to help with a video. There you are. You've got your first offer. Fantastic. Thank you, Steve. So if we can then move on, please, to item 9, which is the Children and Young People's Plan, an update. And I'm just wildly turning pages to find where my notes are. And this is 3 people going to present this as such, and I think we're starting off with Mary White and then Tom and then Joanne as such. So Mary, if you are with us and we can get the presentation up so people can see that at least, and you want to start.
Thank you, Councillor Kendrick. We've actually got sort of two separate pieces going on here. One is the update on the Children and Young People's Plan, and the other is the presentation about SEND.
It is indeed, yes.
Would you like me to start with Children and Young People's Plan, and then we'll move on to SEND?
Yes, please.
Thank you. Thank you. So I'm here this afternoon because a year ago we came to the Health and Wellbeing Board with the draft Children and Young People's Plan, asking you if you'd provide some governance and accountability for the Children and Young People's Partnership, because we'd relaunched that, but we've relaunched that in a way where it's not a formal committee, it's an inclusive network, but nevertheless we work together to develop a Children and Young People's Plan, because part of the point of having the Children and Young People's Partnership is so that we can collectively understand our children and young people population, and we can agree some priorities about what might be useful to address some inequalities in outcomes for those groups. So thank you very much for agreeing to provide that governance and accountability. And this is me coming back with sort of the first set of reporting on where we are with those priorities. There are a whole range of different things that are priorities for children and young people in Kirklees, but for the purpose of the partnership, we've kept the focus on those things that require a whole system to respond, and that require all of the organisations, whether they're statutory, voluntary or community-based, can play a part in delivering that outcome. So the three priorities, after we'd consulted with young people and that we'd looked at a lot of data and evidence about outcomes for children and young people, that the partnership decided that it could focus on, were around reducing the effects of poverty on children, around improving inclusion and outcomes for LGBT plus children and young people. And the third area was around growing our youth offer of places to go and things to do and people to see for children and young people. I'd just like to say, Gareth, I'm not going to share a presentation. The presentation is going to come shortly from a couple of colleagues of mine. So I'm talking to the papers that are in your pack. So we're 1 year in to starting work on the Children and Young People's Plan, and 2020 has been a really interesting year for all of us in all sorts of ways. So one of the first questions that we had to ask ourselves was, are these still the right priorities when the pandemic began and was obviously changing circumstances for all sorts of people? So we spent a bit of time reflecting on that and decided that actually we thought that was the case, because in terms of the effects of poverty on children, what we were keeping a close eye on was how increases in poverty, people losing their jobs, people being furloughed, people not having access to the same opportunities and resources, was obviously that the people who were experiencing that were shifting and changing, and we felt it was important that we kept close links with the Tackling Poverty Partnership and with the people who are delivering community response to be able to respond where necessary to new groups who maybe weren't accessing the support for people living with poverty in the same ways. For the LGBT priority, again, what we were finding was that lots of our LGBT young people were now living at home, sometimes in relatively hostile or unhappy environments, and felt that was something that we needed to add some additional resource to be able to engage with and support those young people. And in terms of the youth offer of providing places to go and people to see and things to do for our young people, that had to shift entirely, because lots of our centres and community provision, sports activities, arts activities, youth work, detached youth work and targeted work with more vulnerable groups had to stop. And we had to find ways of reaching out and connecting to those young people, whether that was online or in other ways. So there was a whole lot of work that went on to think about how we deliver that support. What I've tried to put before you are three different the updates on the three things which set out for you a rationale for why we're working on those priorities, the outcomes that we're tracking, and the progress and the action that we've made. So I'll run very swiftly through that, and then we can talk. Give me any comments or questions about that. So starting with our priority about improving inclusion and improving outcomes for LGBT plus young people. The reason that we've got this as a priority is because of national and particularly local evidence that LGBT young people face additional barriers to achieving their potential. And they may experience more fear and discrimination. And for us locally, what we found was a lot of evidence from our Year 9 health survey. We did for the first time a couple of years ago, we asked people to identify their gender identity and their sexual orientation. And what we discovered from that was that for LGBT plus young people, they tended to be having really significantly different experiences in terms of bullying, in terms of their mental health, in terms of their coping strategies where things got difficult. They were more likely to overeat or not to eat or to smoke or to take drugs than the cohort of children and young people in Kirklees as a whole. We've got a really brilliant group of people from across the partnership working together to develop 4 key themes for this priority. So there's things there which are about supporting the organisations who are working with LGBT plus young people to improve their practice and improve their confidence in dealing with that cohort of young people. We've got a priority which is about voice and influence. So a lot of work going on with the youth out group, in particular the Brunswick Centre's LGBT plus group, to identify what LGBT plus young people are saying about services and saying about their needs and saying about how they'd like things to change or improve for them. We've been doing some work to improve the profile of how we celebrate and make visible the LGBT plus community. So that includes working with events like Pride, like LGBT plus History Month, like the International Day against Transphobia. And the 4th area of work is around data and quality monitoring to try to improve our information and understanding about this cohort of young people and their needs and their outcomes. I've listed a whole load of quite specific actions and progress on the paper there, which I'm very happy to talk about in more detail, but I'm not going to go into that detail here and now because I understand that we're quite pressed for time. The second priority around places to go, people to see and things to do. This is really an offer because of the one of the impacts of austerity was a real reduction in the amount of funding and an opportunity that was available for youth work with children and young people. Certainly within Kirklees Council, we really significantly reduced the amount of youth work that we were delivering, and we no longer had an in-house youth service. But also for the community and voluntary sector, quite a lot of work that happens around this field is relies on organisations supporting each other, and it is not very standalone. So once you take a statutory youth service out, quite often what happens is you also take out a lot of the capacity building and the training and support and some of the opportunities to deliver grants for that work. So we saw a knock-on effect, but we also saw the emergence of something brilliant, which was Kirklees Youth Alliance, which was people in the statutory sector and in the voluntary and community sector saying, actually, we want to move into this space and we want to create a third sector organisation that's a member organisation that can lead that can lead us through this. We've now really moved around again and saying we know that good youth work is good to provide fun and to provide opportunities for children and young people, but it's also a really important space for early intervention, for being able to spot problems that children and young people might be having early and to have some early conversations about them. So it can be good to divert people into services that might be able to support them, or to be able to encourage young people to move away from harmful activities and practices. It's also quite important in terms of early support from a safeguarding perspective. What we've done in this regard is we've set up something called the Youth Programme Delivery Board, which is chaired by our Director for Children and Families, Mel Meggs, and has 5 different work streams, looking at delivering detached youth work, particularly for vulnerable children and young people, looking at creating new spaces and facilities for children and young people. There's a strand which is about the community youth work offer and the role that youth work can give to prevention, what I was talking about in terms of youth work's role in early support. And there's been a significant piece of work to bring together some services delivering activity for more vulnerable children and young people has happened under this strand as well. So we've brought together the youth offending team and the risk and vulnerability team and detached youth work team and the intervention team into a new service called the Youth Engagement Service. So they can make very quick and rapid assessments and referrals between each other to deliver more holistic support to some of our more vulnerable children and young people. Inevitably, lockdowns had a really big effect on how you deliver youth work. So there's been an increase in the amount of online individual youth work that's gone on. We've also had Kirklees Youth Alliance and Conscious Youth, 2 of our organisations, have created a great new facility called called the name's completely gone out of my head. Doesn't that happen? Youth Central. There we go. There's a website called Youth Central, which is the new online youth club for Kirklees, basically, which both sort of hosts activities. It has a youth worker there for quite a number of hours a week who's able to interact with and answer young people's questions and queries, or just hang out with them and see what it is they have to say. And we've also used that to post a whole load of holiday activities in particular for children and young people, and they can be visited and revisited. So we feel that progress is, we're making good progress in that regard. The area of work that we now are focusing on with the Youth Programme Development Board is about deciding how do we measure outcomes? How do you measure the outcomes for good youth work? Because quite often the outcomes are things don't happen to those children and young people. They don't end up being absent from school or getting themselves involved in the fringes of the criminal justice system, for example. So we're doing a piece of work on outcomes there at the minute. The third priority is around poverty, and this is something that at the same time as the Children and Young People's Partnership, we're saying that we wanted to do some work to reduce the effects of poverty on children. There was another piece of work that was going on to revisit our tackling poverty strategy in Kirklees. So we decided there was no point in having two separate pieces of work. What we would do was that we would combine those pieces of work into the new Tackling Poverty Partnership and Action Plan, but we would develop some actions that particularly around children and young people there. So that action plan is still being developed, but we know that the children and young people's aspects of it will be about how we share good practice and support our schools to poverty proof the school day, so that children who live with poverty can have the same experience and outcomes in school as children who don't live with poverty. We also decided that we need to do a deep dive piece of work on free school meals, because we have an increasing number of children who are eligible for free school meals here in Kirklees. And some schools do a really brilliant job of encouraging their families to take up the free school meal offer. And in other schools, you see a picture where they have quite high eligibility, but not very high take up of free school meals. So we're going to be doing a piece of work which is doing some further analysis on that and looking at what we can do to improve that situation for children and young people. There's a whole piece of work around economic recovery, which I'm sure people will be aware of, about the economic impacts of the pandemic having effects on all of the population. But for children and young people who are trying to enter the labour market, or who are more likely to be in jobs which don't have decent contracts and don't have decent terms and conditions, or they're more likely to work in hospitality and service industries and be furloughed or be made unemployed, it's really significant for that group. So we're working with the Economic Partnership to look at how we can make sure that things like the Kickstart programme and the Restart programme have children and young people at their centre, and how we try to safeguard employment opportunities for that cohort of children and young people. A large part of the work this year has focused on response to the pandemic, really, about looking at those children and families who are moving into poverty and who need crisis intervention support. So whereas we'd hoped to do some sort of immediate crisis work and then some longer term work around preventing poverty from happening in the first place, I have to say that quite a lot of the energy and resources are going into the crisis prevention work at the moment, simply because of the scale of the issues that we're dealing with, because we've seen an increase of about 2,000 children, for example, becoming eligible for free school meals in the 9 months since we first measured that information. I'm going to stop talking now and
Okay.
leave it there.
Thank you very much, Mary. You've given us a good run through that. I think a lot of the points that you make in the context of these reports are well made. I mourned, as many councils did, the loss of youth provision, and I think I know the value of it. Sadly, we weren't different from a lot of other local authorities when budgets were so tight as such. I do believe whatever the youth provision turns out like, develops into, it is essential about that early potential for early intervention. you know, because an investment in youth services potentially means savings in children's services. That isn't the reason for doing it, but it is a benefit that's potentially there. And you talked about how you measure success in the terms of that, and I know what you're saying. It's very hard to measure something that hasn't happened. I suppose a general measure might be what the mental health is in general of young people in Kirklees, emotional health. I don't know if that would be a way to go. And just in commenting on the first part of the report, I was really surprised and stunned by the gap in terms of isolation from LGBT young people. I hadn't realised the scope of that. I was aware that there was some, and also the range of the greater increase in risky behaviours within that cohort of young people. You know, so I think the three things that you folks have been working on are absolutely essential and valid. And I think, thank goodness you didn't try and fix everything, because you've got three huge things to bite on there. Sorry, I'm drivelling on. Have any colleagues got any questions or comments they would like to make, please? No? Then thank you very much for that, Mary. It's excellent. Can I move on to Tom Brailsford then and Joanne Sanders, who are going to talk about the SEND stuff?
Thanks, Councillor Kendrick. I think Phil's going to load the presentation up for me, because I've got having slight technological problems with my computer. But just to say, today we're bringing the SEND work and the high needs work that we've been doing with Empower back into view for the Health and Wellbeing Board. I think members might recall we brought the 10-point improvement plan for SEND previously. I think that would have been last year, and the ambition is to go through the transformation work we're doing and update the 10-point plan. So it's just to bring it into view for board members and for comment, really, particularly around the fact that this impacts on the whole system. So it impacts on health providers, health commissioning, and a number of other areas. So I'll lead the presentation, and Joe will chip in as and when, if that's okay. So Phil, can we go to the next slide? Okay, so we've been working with Empower since, I think it was since January, and obviously the work got interrupted through the first lockdown. And really the purpose of the work that we've been undertaking is to understand the SEND and high needs system, to understand the current service in terms of cost and what's the demand position, to try and identify opportunities to deliver good outcomes, and also look at a financially stable, sustainable system, and also to have that kind of whole inclusive ambition for children and young people who've got additional needs throughout Kirklees, and to have that shared across all the partners. And also to improve outcomes for children and young people with additional needs by moving further towards a strength-based approach rather than a deficit-based approach. So there's been a number of things undertaken as part of that process. And if you just move on to the next slide, Phil. So there's been a lot of engagement which has driven the findings that before you today. There's been a lot of engagement with parents and carers, looking at high needs professionals, adults and LD professionals. There's been some panel observations, so colleagues have been observing the way we make decisions about children and young people's needs. There's been some clear focus groups. There's actually been some very detailed case reviews looking at the details in a number of cases and the needs and how that's worked. And also that's involved using something called the Value in SEND tool, which is in effect an outcome-based tool which maps needs across parental needs, child needs, and the educational settings needs. And we did that on a multi-agency basis in the days when we could get together. A number of us got together down at the Textile Centre and worked through real cases to drive this insight, really. So that was really useful. Phil, next slide, please. Okay, and what's becoming kind of increasingly clear is that there's an increased demand across the system, and some of that demand is not driven by need; it's driven by behaviours which is not necessarily the right way around. So we have seen a big increase in EHC plans by 29.6% in Kirklees. We know demand for EHC plans has increased across all setting types, both special schools and mainstream schools, but we have seen that mainstream schools have experienced the largest growth in demand by 67.5%. Just move it on, Phil. Thanks, Phil. So I think it's important that we kind of don't underestimate the scale of the challenge. Demand and costs are increasing across the board. So since 17-18, demand's increased by 29.6%, and is inputting increasing pressure on the high needs block, and also that'll equate to increasing pressure on health services such as speech and language therapy, occupational therapy, children's continuing care needs, etc. So despite all this high spend, what we know is exclusions in Kirklees are increasing. The number of permanent exclusions has increased significantly. And this to us kind of suggests there's obviously significant unmet need out there. From the case reviews and a lot of the work we did, it's really clear that opportunities to meet needs in an early intervention type way are being missed. So through the case review process, it was identified that in 73% of the cases, people felt, and this is professionals on the ground, people felt there were opportunities to prevent, reduce or delay the level of need that they were currently dealing with. And again, what we do know from recent surveys is that COVID-19 is likely to have a further impact on demand and spend. There were many parents who indicated the child or young person's need had changed during lockdown and felt that throughout that period the needs had not been met. So, it's whether we start to see more demand coming through moving forward. Next slide, please, Phil. So, in terms of taking this forward, Joe, I don't know if you want to kind of say a bit about the process we've been going through in terms of the inclusive ambition side of things.
Yeah, thank you, Tom. So I suppose that what that work put back a challenge to the system. It's not just to the local authority, it's to that whole system supporting youngsters with additional needs, special educational needs and disabilities. And it felt like a real opportunity to have that conversation about what are our shared ambitions, because I don't think anybody would disagree that we want the best outcomes for our youngsters, all our youngsters, but how can we work more cohesively together? So last month we had a real opportunity to bring together key strategic colleagues across the system and have some really good discussion about what did we want, how best do we meet need as early as possible, how best could we use our resources to the best effect, how do we get the right intelligence so that we are shaping the system moving forwards, and how importantly are we doing that in partnership, co-designing that with our parents and carers. And absolutely, we don't want to see youngsters being excluded from school. We need to work together to find better strategies. And I think some of the things that, and he said this is not unique to Kirklees, it's how different accountability systems, so education accountabilities, those from health, those for us as a council, how we can influence some of the system of accountabilities, but how can we align them as best we can, and how best can we influence that system together? So we had some really useful conversations that have led to I suppose some conversation about developing that inclusive ambition that we can all share, which will direct our transformation moving forwards. Next slide, I think, please.
Do you want me to pick this up, Joe?
Thank you, Tom.
Yeah. So in terms of, as Joe's saying, in the Inclusive Ambition workshop, I think we had it in, I think it was October. And part of the challenges that we shared at that workshop, which the cross section of partners there, was about looking at making sure we've got a challenge about behaviour and culture challenges in a system that's not joined up really. So what we're hearing from parents is that we've still not got join up between education, health and social care in terms of those outcomes. And also we've got behaviours which promote moving children and young people to the highest level of intervention and need an EHC plan, when actually what we should be doing is trying to meet need at SEN support or even earlier, really, at the earliest possible opportunity. So we've got the challenging around early intervention, and also the needs and outcome measurement being unclear. So we've got a lack of a cohesive data set locally, which gives us the shared progress and needs of children across the system. I think, to reflect on the not joined up aspect of it, 40% of professionals who responded to the survey felt assessments didn't consider the holistic needs of children and young people. And I think we really need to look at a different way of measuring and articulating needs, and looking at progress of children and young people and value for money. Next slide, Phil. Yeah, so basically at the end of this phase of the high needs transformation work, we want to have an agreed system-wide ambition, which is co-designed across the partnership, and also reflects on our 10-point improvement plan for special educational needs and disability. We want to establish an embedded governance approach across high needs, which is basically tracking the needs and demands of our children and young people and making sure that we're clear about those. And we're in the process of developing and introducing 2 system-wide interventions. One's a value incentive, which I talked about, which is basically an outcome tool which helps us track and meet need better. And the other one is an information, advice and guidance hub, which is designed to provide advice and support at the lowest possible tier of provision. And that's going to be co-designed with parents and other professionals. I've included the draft inclusive ambitions on the slides, but I won't talk through them. Phil, if you just go through the next 2 slides. Thanks, and then to the third. Brilliant. So the 3 main areas of focus over the coming months are going to be confirming the shared ambition, and having a 24-month 10-point plan based on that. That's going to be on the 1st of December, and we're trying to encourage as many people as possible to attend, across health providers, education providers, and others. We'll be delivering those high impact interventions, so the new advice and information hub and vSend, and actually we're looking at a go live date of early 2021 for that. And as I said, we'll be establishing the trajectory governance board by the end of 2021, which will set up a robust reporting cycle and let us monitor what the system's outcomes are. So thanks for that, Phil. If you want to stop sharing the screen, that's great. And I think Councillor Kendrick Joe's lost connection.
All right. Oh dear.
Just texted me.
Thank you for that. And thank you, Joe, even though you've lost connection with us. Anybody got any comments or questions about that? I feel it's the right and an ambitious process to go through, but it can only be the right thing to do for children and families faced with the high needs that they have. Helen, you have a question, please.
Yeah, it sounds like there's been a huge amount of work done to gather insight from families, which is fantastic. I was just wondering, given that people have expressed some dissatisfaction, there's clearly a programme of work that is resulting from what has been indicated.
Yep.
How well are we communicating back to those families that actually there is change happening as a result of the fact that we identify that there are these demands?
Yeah, what we're doing is really co-producing the whole process with our parents with the children with additional needs group. So they've been involved in the whole aspect of it. And I think, you know, what it's really important we do that, because, you know, we can't ask people what's wrong with the system and then not give the feedback loop. So as part of the inclusive ambition, that gets shared back with parents and carers as well. But also one of the things we're thinking about doing, which I think could be a great idea in terms of the advice and information hub, is having kind of some some low-level parental feedback in there, some multi-agency feedback. You know, we might get the designated clinical officer in there, we might get a speech and language therapist in there, to make sure there's a consistent feedback loop to parents. And the other thing that we're doing is gathering the information and data through our voice team, our children and young people's voice team, about obviously, you know, the experiences of children and young people and you know how that feels. But it did occur to me, Helen, when I came on the meeting today, because I've been to Health Wellbeing for a while, it'd be useful for us to link up actually in terms of some of that young people's engagement stuff, because, you know, we've done some in the council as well around COVID. So it'd be useful if we could maybe get you involved in this work, if that's okay.
Thank you very much. Steve Ollerton, and I've lost the message now, here we go, had asked, do you think demand will keep increasing?
Yeah, inevitably. So if we don't do something about that demand, it's going to, you know, the trajectory of increase it is quite significant. And I think, and we're starting to see, you know, we see that in terms of the budget, Steve, but we're also starting to see the impact on children's community health services. So, you know, where, I don't know, maybe 4 years ago, CHFT and Mid Yorks and Local weren't spending as much time on education and health social care plans. That's increased significantly. So we do, you know, there is a graph, which maybe I should have included, that if we don't do anything, what it looks like. So yeah, but I will say as well, it's not just about demand. It's about doing the you know, the right interventions at the right time.
Yeah.
And actually, most children and young people's needs can be met at a lower level of intervention. It's just, it feels like we've just got a system that drives demand further up the system.
Thank you. Anybody else with a query or question? I'm not seeing one. Okay. Thank you very much for that. Thank you, Joanne. Thank you, Tom. Thank you, Mary, for that presentation. We don't normally have any other business on this agenda because it has to be printed beforehand. And I know Carol McKenna has had to leave. Phil, are we still someone here from the CCGs? I can't. I'm just seeing initials everywhere. Ah, of course. Dr. Steve Ollerton, how could I forget you? Carol intimated there was something that perhaps the CCGs would want to announce.
Yeah, thank you, Viv. And apologies, Carol has literally only left about 5 minutes ago because of some NHS England stuff that's going on at the moment that I'm sure will be reaching your news feeds imminently. But I won't spoil that one. I'll let you go and Google NHS England after this meeting. But yeah, we're talking about announcements being landed on you. That's another classic example. Anyway, I wasn't talking about that. The only other business is the decision that was made, was ratified yesterday at the joint governing body of North Kirklees and Greater Huddersfield CCG. For those of you who've been involved in this, for well over a year now, we have been talking about merging the CCGs into a single Kirklees CCG. For those of you who don't know the mechanics of it, this is actually a decision that rests with the member practices, with the GP practices. It cannot be done to us. And through various stages in the year, there was not not a mandate from the practices to form a single CCG. Anyway, I won't bore you with what changed, but COVID was a significant factor and working together. And as of about 2 or 3 weeks ago, the North Kirklees and Greater Huddersfield practices decided that yes, this was the correct thing to do now, for a variety of reasons. And certainly I know the Health and Wellbeing Board, the local authority, Locala, various partners have always thought this was the right thing to do. And finally, our member practices have decided this is the right thing to do. So yes, they therefore have put forward the vote, and the vote was overwhelming, to be honest, vast majority of practices. So we had a governing body yesterday, and we have hastily put an application into NHS England, which should have been in about 3 weeks ago, I think. But NHS England have said that's fine, as long as you can work on this, then we put the application in. And I think literally the application goes in on Monday. We will then meet with NHS England next week, and it is for them to approve the application. But provided that goes ahead and all goes ahead properly, then we will become a Kirklees CCG from April the 1st. I think that just about covers it. So if there's any questions on that.
Thank you very much, Steve. I don't know if colleagues have any questions, but I can only say I absolutely welcome it. For Kirklees footprint to have one CCG is just absolutely essential in my view. What that counts for, goodness knows, but you know, I absolutely welcome it.
And as you know, Viv, I have always said that it was the right thing to do, but unfortunately, it was not a decision I was allowed to make.
Absolutely, absolutely. Yeah, I'll be really pleased, really pleased as long as that gets approved and goes through, and I think it will be a huge benefit for Kirklees.
Because actually, I mean, NHS England have been pushing us to do it, so it would seem a bit odd if they then say, no, you can't. So, but it will be up to them.
I think Dr. Khalil Naeem wants to make a comment.
Thanks, Viv. And thank you, Steve. And Steve has summed it up quite well, I think. And he's right. We have done it the right way. We waited for practices to come to this decision instead of pushing them into it. You know, there was a long process of listening to practices, engaging with practices, and deciding on the future makeup of the CCG, and we've overcome a lot of contentious issues, and then we are now in the process of formulating our constitution, which is in the draft form at the moment, and we are also listening to some of the Health Watch, feedback, patients, feedback into it, where people have expressed views of positivity, but at the same time they have shown a wish to be represented well on both the patches, and what we have done from our end is, rather than thinking of north and south, we are now looking at locality level, and we are looking at other PCN levels, where we've got representation from each locality, each PCN. We've divided the whole of the Kirklees into 9 localities, and that will probably help us in meeting the needs of healthcare needs of people more locally, and then knowing their healthcare needs, knowing that each of these patches have got different healthcare needs in different patches. So I think that representation would be very helpful, and that's how we are going to move forward, in my opinion.
Well, my very great congratulations, and particularly on your patience in working this through so it happens at the right time for the practices. Thank you very much. Helen, were you saying you wanted to add something to this?
Yeah, all that I wanted to mention, so we understand the kind of strategic and operational benefit of the CCGs merging. I guess I'm mindful that our population perhaps don't see all of the component parts of the NHS, so they don't necessarily know the difference between a hospital trust and a clinical commissioning group, and that perhaps we need to be really, really clear in how we communicate the merger to the general public to make sure that they understand which part of this system is actually coming together, because it could create, I think, quite a lot of nervousness for people completely unnecessarily if there isn't that clarity in understanding. But that's all.
Perhaps the CCGs might want to work with Health Watch in getting that as good as it could be. Not saying that you can't do it, gentlemen, but you know, I think there was a willing volunteer somewhere there.
Yeah, there would be some public engagement events planned in our routine public engagement program, and we will be announcing and introducing people to it.
Lovely. Thank you very much. Can I just say thank you to everybody who's presented today, who's contributed to today's meeting and attended it. That is the end of the meeting now. My apologies to people who were trying to watch for the technical difficulties. I'm afraid far beyond my capabilities to resolve that, but my apologies for that. And to say the date of the next meeting will be the 28th of January 2021. So I will look forward to seeing you as the Health and Wellbeing Board in the new year. Hopefully I will see some of you before then as well. Thank you very much.
Happy Christmas and Happy New Year to everybody.
Thank you.